Imagine an ancient tree that survived dinosaurs, ice ages, and even atomic bombs. And it might just sharpen your memory, boost blood flow to your brain, and fight inflammation. Sounds too good to be true. This is Ginkgo biloba, one of the oldest living plants on Earth. Today we're breaking down the real benefits, the science, the potential downsides, and exactly how to use it safely. If you want better focus and brain health, keep watching. Ginkgo biloba, also known as the maidenhair tree, is a true living fossil. Its fan-shaped leaves have been used in traditional Chinese medicine for thousands of years to support brain health, circulation, and overall vitality. Today, millions of people take it as a supplement. But what does the science actually say? First, the exciting part. Ginkgo is packed with powerful antioxidants and flavonoids that help combat oxidative stress and reduce inflammation in the body. One of its most studied effects is improving blood circulation. By helping blood vessels relax and flow better, it may support better oxygen delivery to the brain and extremities. This is why some people report benefits for conditions like intermittent claudication, leg pain from poor circulation. On the brain side, many studies suggest ginkgo may offer mild support for cognitive function, memory, and focus, especially in older adults or those with mild cognitive concerns. Some research shows potential neuroprotective effects. While results are mixed, and it won't prevent dementia on its own, certain standardized extracts have shown promise in trials for stabilizing memory and mental performance. Other potential perks include support for eye health, tinnitus relief in some cases, and overall antioxidant protection. Important disclaimer: the evidence is not unanimous. Large studies like the Ginkgo Evaluation of Memory trial found limited effects on preventing cognitive decline in healthy older adults. Benefits appear more noticeable in specific situations or with consistent use over weeks to months. It's not a miracle pill, but for many people, it's a helpful natural addition when used correctly. Now, the balanced view. Is ginkgo safe? For most healthy adults, yes. When taken in proper doses, common mild side effects can include headache, dizziness, stomach upset, constipation, or heart palpitations. More seriously, ginkgo has blood-thinning properties, so it can increase bleeding risk, especially if you're on blood thinners, aspirin, NSAIDs, or have surgery coming up. Always talk to your doctor first. Never consume raw or roasted ginkgo seeds. They can be toxic. Pregnant or breastfeeding individuals should avoid it unless advised by a healthcare professional. Quality matters. Look for standardized extracts like EGB 761 with 24% flavonoids and 6% terpenoids. So how do you actually use it? The standard dosage is 120 to 240 milligrams per day of standardized leaf extract, divided into 2 to 3 doses. For example, 40 to 60 milligrams 3 times daily, or 80 milligrams twice daily. Capsules and tablets are the most common and convenient forms. You can also make tea from dried leaves. Just steep 1 tablespoon in hot water for about 10 minutes. Take it with food to improve absorption and reduce stomach issues. Give it 4 to 8 weeks or more to potentially feel benefits. Start low to test your tolerance and buy from reputable brands with third-party testing. Ginkgo biloba is a fascinating herb with a long history and some promising science behind it, particularly for circulation and mild cognitive support. It's not a cure-all, and results vary, but when used wisely, it can be a valuable tool in your wellness routine. Have you tried ginkgo before? Drop your experiences in the comments. Like and subscribe for more evidence-based natural health content, and hit the bell so you don't miss the next one. This is not medical advice. Always consult your healthcare provider before starting any supplement. Thanks for watching. Stay sharp.